An emergency meeting of Caribbean community heads of government was held on Wednesday to address the regional fight against the spread of the COVID-19 pandemic. US President Donald Trump's announcement that he was halting funding to the World Health Organization in the midst of the novel coronavirus pandemic has sparked global rejection. G20 nations announced support for a temporary halt to debt payments by the world's poorest nations as they struggle to deal with the coronavirus pandemic. From the headquarters of Telesur English in Havana, Cuba, this is From the South. I'm Katrina Goss. An emergency meeting of Caribbean community heads of government was held on Wednesday to address the regional fight against the spread of the COVID-19 pandemic. Prime Minister of Barbados, Mia Mottley, the current CARICOM chairperson, stressed on Wednesday that leaders discussed the regional response to COVID-19. The meeting was held via video link in keeping with the social distancing protocols due to the novel coronavirus. CARICOM members undertook an economic analysis on the impact of COVID-19 on regional economies and considered proposals for common public health and border policies. The meeting was also an opportunity to share experiences in combating the virus in each country. The Caribbean region has reported over 5,200 COVID-19 cases and over 300 fatalities. Jamaica has recorded 32 confirmed COVID-19 cases in a single day, taking the total to over 100, while 5 fatalities have been reported.
So Jamaica can now confirm that we have 105 cases of COVID-19. This follows 32 new additions over the last 24 hours. The new cases comprise of 5 males and 27 females who range in ages from 19 to 70 years old. The cases are from St. Catherine, Kingston, and St. Andrew. They bring to 34 the number of cases under investigation. Of the remaining 71 confirmed cases, 31 are imported, 34 are contacts of a confirmed case, and 6 are local transmission.
Venezuelan migrants who arrived in Colombia from neighbouring countries are waiting to be transferred to their home country by bus, as Colombia's government grapples with a migration crisis brought on by the COVID-19 pandemic.
The unfortunate number of sick and dead in Ecuador has meant a migration process of Ecuadorians, Colombians, Venezuelans, and other nationalities through the porous border. Those who are here now and who are going to be transferred are recent arrivals, migrants from Ecuador in the situation of the pandemic, which is an argument, let's say, different as the pandemic presents different conditions.
In the meantime, migrants fear the risk of infection while they wait to cross the border and return home.
We were scared because when we saw the problem there in Quito, first it was in Guayaquil, then the epidemic arrived in Quito. When we saw the first one who collapsed and fell dead, a man and a woman, then we said to ourselves, let's go, let's go, let's go, and we came at once. We escaped from the crisis there in Venezuela because, as everyone knows, it's not a secret for anyone that the crisis is a little strong. But for me, it's more feasible to be with my family there, in the middle of the pandemic, and not be here in Colombia where I have no benefits.
The UN envoy for Colombia reported this Tuesday that former combatants are now making face masks to respond to the novel coronavirus pandemic. Despite the COVID-19 lockdown in Colombia, the widespread violence against social leaders, human rights defenders and former combatants hasn't stopped. Carlos Massieu, Special Representative of the Secretary General and head of the UN Verification Mission in Colombia, told the Security Council that 3 social leaders and 3 former combatants were killed in recent weeks, bringing the number of former combatants killed since the peace agreement signed in 2016 between the Colombian government and the FARC guerrilla group to 195. Massieu urged the government to adopt all necessary measures to protect all victims of violence and stressed that while the COVID-19 pandemic is and will continue to affect the implementation of the peace agreement, all parties have an obligation to ensure progress in fulfilling it. Brazil has reported over 26,000 COVID-19 cases and its death toll has reached over 1,500, making it the hardest hit nation in the Latin American region. Our correspondent Brian Meir brings us more details.
In the last 24-hour period recorded by the Brazilian National Health Ministry, 204 more people have died because of coronavirus. However, more and more academics and scientists are questioning these numbers. After the National Center for Health Intelligence Information released a study based on hospital records estimating that the real infection rate is 12 times higher than the numbers that the government is providing due to lack of testing. Another study was released by scientists from USP, the State University of São Paulo, and UNB, the Federal University of Brasilia, which also uses existing hospital records, which are updated daily, to estimate that up to 15 times higher number of people might be infected by coronavirus than the official rates. So this has been attributed to several factors. Lack of testing. Brazil has one of the lowest testing rates in the world, but also people are beginning to question whether the motives behind this are political, because far-right President Jair Bolsonaro is trying to end lockdowns, trying to end quarantines to please his backers in the international and national capitalist community who put profit above human lives.
And the novel coronavirus continues to spread across Latin America. Ecuador has reported more than 300 deaths and over 7,600 positive cases, mainly in the coastal city of Guayaquil, the epicenter of the epidemic. Ecuador has been under a state of emergency since March 16th, with strict measures that limit movement. Meanwhile, Colombia has reported nearly 3,000 COVID-19 cases, with the authorities confirming 15 more fatalities, taking the death toll to 127. Brazil remains the hardest hit nation, followed by Peru with over 10,000 cases. Chile has now dropped to third place in the region with over 8,000 cases and a total of 94 fatalities. On Wednesday, Bolivia's de facto president, Janine Áñez, announced that the government had extended the country's nationwide COVID-19 lockdown through April 30th. Bolivia has reported 397 cases and 28 deaths. The Ecuadorian government of President Lenin Moreno announced new economic measures in the midst of the COVID-19 health crisis. More details in the following report from Quito.
The national government has proposed a set of economic measures to address the health crisis caused by the new coronavirus. They include the renegotiation of external debt, setting up a national account for humanitarian assistance for health, food, and employment. Also, people earning $500 a month will have to make a progressive contribution for 9 months.
These measures are not a response to the health crisis. They are intended to resume the agenda with the IMF, suspended in October. They propose a fiscal and labor reform in the same terms as the IMF dictator, but even more radical. These proposals intend to include the elimination of subsidies and benefits to the banking industry.
The announcements caused backlash by different sectors, including the Unitary Workers Front, who insist that the government takes their proposals into account.
It is time to suspension the external lead payment. The state pays $12 billion every year. If we suspend payment, we will have resources to tackle the crisis. And for wages that until now have not been paid. It has been publicly out that 265 families have bank accounts abroad. Let's propose a tax on these for the state to have new sources of income.
The government has said that the purpose of its economic plan is to protect the most vulnerable and avoid layoff.
This regime will establish agreements between the parties to preserve jobs and job sources. They will be able to agree on new wages, different work days, as well as debt extensions and new house payments. These would avoid layoffs. That is our objective.
The Chamber of Commerce in Quito also articulated its position through its chairperson, who posted on his Twitter account that there were other alternatives to tackle the crisis, like reaching consensus to discuss structural reform, overhaul the state to cut expenses, empowering the private sector with the strategic sectors, and targeting subsidies, among other things.
More stories coming up after this very short break, so don't go away. Welcome back to From the South. US President Donald Trump's announcement that he was halting funding to the World Health Organization in the midst of the novel coronavirus pandemic has sparked global rejection.
It is my belief that the World Health Organization must be supported. It is not the time to reduce the resources for the operations of the World Health Organization.
We therefore regret, whenever there is a setback in multilateralism, that this setback happens, and we obviously very much hope that there will be a swift return to normality, and that the WHO, which like all the countries of the world has faced an unprecedented pandemic, can carry out its work calmly.
The current global epidemic situation is still grim and is at a critical moment. This U.S. decision will weaken WHO's capabilities and undermine international cooperation in fighting the epidemic. It will affect all countries in the world, including the U.S., especially those vulnerable to crisis. We urged the U.S. to earnestly fulfill its responsibilities and obligations and support WHO to lead international cooperation in fighting the epidemic. China will, as always, support WHO and play an important role in promoting international public health and contributing to the fight against the epidemic.
Over 27,000 people have now been killed by COVID-19 in the United States, the global epicenter of the pandemic. Coronavirus deaths spiked in New York City by more than 3,700 after officials began including people who had never tested positive for the virus but were presumed to have died because of it. The latest figure brings the total number of fatalities in New York City to more than 10,000. Disagreements between local and regional health authorities over the number of COVID-19 deaths have also been blamed on the use of different data systems. New York City authorities have complained that the state has dragged its feet in sharing data from hospitals and nursing homes. The COVID-19 death toll has shot up dramatically in the United Kingdom, with 1 in 5 deaths in England and Wales linked to the coronavirus, while the government has been accused of under-reporting deaths of the elderly in care homes. The death toll has increased by more than 5,000 in just 1 week, which suggests that official daily coronavirus figures published by the government have been inaccurate. Of all coronavirus-related deaths registered up to April 3rd, just under 10% occurred in hospices, care homes and private homes, according to the Office of National Statistics. The UK government has come under fire from senior health officials for not providing enough personal protective equipment for frontline workers. Official figures show that more than 93,000 people in the UK had tested positive for the coronavirus in hospitals, of which around 12,000 had died by this 4th week of lockdown. The Spanish Health Ministry this Wednesday reported that the number of coronavirus deaths in the past 24 hours had fallen again to 523, 44 cases less than reported the previous day. The latest figures brought the total number of fatalities to over 18,500. Meanwhile, the overall number of cases in the country rose to over 177,000. This week, certain non-essential sectors, including construction and manufacturing, were allowed to reopen, but most workers across the country remain in lockdown until at least April 26. The government has stressed it will carry out mass antibody tests of 60,000 randomly chosen people over 3 weeks to begin to identify those who could now be immune after exposure to the virus. Spain remains one of the world's worst affected countries, with only the United States and Italy recording higher death tolls. French Finance Minister Bruno Le Maire announced on Wednesday that a large part of France's economy is operational, as close to 60% of the country's industry has restarted after being shut down due to the coronavirus pandemic. The minister warned last week that France is likely to see its worst post-war economic slowdown this year due to COVID-19 and much worse than it faced in 2009 after the global financial crisis. Meanwhile, the lockdown has been extended until May 11th. The French government has increased the expected cost of its measures to support the economy through the coronavirus crisis to €110 billion, with the country's GDP set to suffer its biggest drop in decades. France is the world's 4th worst hit nation by the coronavirus, with the death toll having exceeded 17,000, while there are more than 147,000 people who have been infected. European Commission President Ursula von der Leyen warned EU member states on Wednesday to be cautious in lifting the restrictive measures imposed to slow the spread of the coronavirus, as Austria, the Czech Republic and Denmark already began lifting some lockdown measures.
I want to make sure that this is not it is not a signal that containment measures can be lifted as of now, but it intends to provide a frame for member states' decisions. In general, we recommend a gradual approach. Every action should be continuously monitored whether the virus flares up again or the spread of the virus stays stable below a certain threshold. If you have the threshold of the virus and the capacity in the healthcare system, you need sufficient surveillance and monitoring capacity in form of large-scale testing. These preconditions are accompanied in this roadmap by a series of recommendations to ensure a gradual, consolidated, and a coordinated access across the European Union.
China reported a fall in new coronavirus cases in the mainland on Wednesday, but an increase in number of local transmission in its far northeast region bordering Russia. 46 new confirmed cases were reported on Tuesday, compared to 89 cases a day earlier, according to the National Health Commission. Of the new cases, 36 involved travellers arriving in China from overseas, compared with 86 a day before. China has closed the border with Russia at Sufein, a city in Heilongjiang province, with a border checkpoint into Russia. New infections involving travellers arriving from Russia have also hit other parts of China, such as the northern autonomous region of Inner Mongolia and the financial hub of Shanghai. The government has launched an epidemiological survey in 9 regions in an effort to determine the full scale of asymptomatic infections. The total number of confirmed cases in mainland China has surpassed 82,000. And we're taking one last break now, but stay with us for more. Welcome back to From the South. G20 nations announced support for a temporary halt to debt payments by the world's poorest nations this Wednesday as they struggle to deal with the coronavirus pandemic. The group, composed by the world's largest economies, also called on private creditors to participate in the initiative.
Ministers and governors have worked as well to deliver international financial assistance to the developing countries. Our actions today include a G20 initiative to suspend debt service payment for the poorest countries. All bilateral official creditors will participate in this initiative.
The usually bustling streets of New Delhi's commercial district were deserted this Wednesday as India began the second phase of the world's largest coronavirus lockdown. The measures aim to prevent the virus overwhelming the country's already strained healthcare system. Indian Prime Minister Narendra Modi extended the lockdown on Tuesday as the coronavirus caseload surpassed 10,000, with more than 300 deaths reported. India's population of 1.3 billion has been ordered to stay home until May 3rd, but officials said some restrictions distanced from infection hotspots would be eased on April 20th to help poor people dependent upon daily wages. Authorities in many states have been arranging for food supplies and rations to be distributed among the poorest residents with the help of aid groups. India has a long history of battling infectious disease, from a 19th century malaria epidemic to the Nipah virus outbreak in 2018. President of Malawi, Peter Mutharika, has announced a strict 3-week lockdown to tackle the spread of COVID-19. The president said during a press conference held this Wednesday that the lockdown will end on May 9th, but could be extended further. Meanwhile, dozens of health workers in Malawi's commercial capital, Blantyre, have staged a sitting to protest against poor working conditions, including a critical shortage of personal protective equipment. The action came despite the National Organisation of Nurses and Midwives on Monday calling on its members to return to work following a brief strike over the weekend. Malawi, one of the last African countries to confirm the presence of the coronavirus, has reported 16 cases and 2 fatalities. Namibian borders will remain closed and a partial lockdown in force for a further 2.5 weeks until May 4th as part of new measures to contain the spread of the novel coronavirus. The sparsely populated southwest African country of under 3 million people has confirmed 16 COVID-19 cases but has not reported any new infections in the past week. Mining operations, which make up half of Namibia's export revenue, have been suspended pending the lockdown. Informal traders and open markets will still be allowed to operate, subject to strict hygiene and social distancing measures. South Africa's health minister reported a rise in coronavirus cases, taking a total to over 2,500. The African nation has conducted over 87,000 tests so far. Likewise, the donation of equipment from China is set to help South Africa to fight this invisible enemy. The donation included 10,000 N95 masks and disposable gloves, as well as other personal protective equipment. The rate of new infections has slowed significantly since President Cyril Ramaphosa ordered a nationwide lockdown on March 27th, which has been extended to the end of April. The United Nations warned on Wednesday that some 74 million people in the water-scarce Arab region are at greater risk of catching the novel coronavirus because they lack a sink or soap at home. According to the UN report, 31 million people in Sudan, more than 14 million in war-torn Yemen, and 9.9 million in Egypt are considered at high risk of infection. Refugees and people living in conflict areas or under occupation bear an additional burden. While hand washing has been promoted as one of the key prevention measures against the coronavirus, an estimated 26 million refugees and displaced people are at greater risk of contracting the illness region-wide, as they lack adequate access to water and hygiene services. And today, the Grand Theatre of Havana, named after the prima ballerina Alicia Alonso, is celebrating the 182nd anniversary of its founding. Even in the midst of the current coronavirus pandemic, its anniversary is being celebrated. The following video aims to bring us closer to the workers, artists and public of this emblematic Cuban cultural institution. Don't forget to follow us on social media. For Telesur English, I'm Katrina Goss, and thank you for watching.
Hoy cumplimos un aniversario más. No podemos celebrar como quisiéramos, con una gala, con tu presencia. Ahora toca ser responsables, aislarse y esperar la calma. Ya tendremos ese día de volvernos a ver, de llenar la sala, de disfrutar la música, de la danza. Donde estés ahora, también festejamos.